Rahmatullah. Sabah al-khair. Good morning, everybody. Thank you, Mr. Chairman, for your kind introduction. Today I'm going to talk about the esophageal cancer, who is at real risk. I have no disclosure. So the esophageal cancer is the 9th most common cancer and is the 6th leading cause of death worldwide, and is highly fatal, account more than 500,000 deaths per year. It has poor prognosis, cancer in late stage. Actually, it has two main subtypes. Histological subtype. The first one is a squamous cell carcinoma, and the second one is the esophageal adenocarcinoma. Globally, the squamous cell is the most common subtype and account more than 80% of cases, and it has multi-risk factor, while the adenocarcinoma, it is account about 20% mainly in white population and in the developed countries. So the epidemiology, overall the incidence rate, according to the Global Cancer Observatory in 2020, it showed around 600,000 people worldwide diagnosed with the esophageal cancer, around 3.1%, and the age standard incidence rate around 1.5%. The incidence per gender, actually it is more common in men, and men to female ratio it is more than 8, mainly in the high index developed countries, while in the low index developed countries around 2 to 4 male to female ratio. But the incidence by population, actually it is a vary between the population. It is more common in the Eastern Asia and Eastern Africa, and we call this one the esophageal cancer belt, and less common in the Middle East. Now we'll talk about the risk factor. The first one is socioeconomic factors. The first one is the smoking. The smoking has linked to smoking to a strong relation with the squamous cell rather than the adenocarcinoma subtype, and the risk actually it is vary between population, between fold increase in sub-Sahara Africa, but to minimum 30 to 50% in the Asia. The alcohol, the second one, the alcohol drinking increased risk of esophageal cancer. Meta-analysis of 74 study showed the 5-fold increase with the squamous cell risk rather than the adenocarcinoma. The opium, the international research group on cancer showed they classified the opium as carcinoma, and actually it has mild to moderate association with the squamous cell carcinoma, but no study relation between the opium and adenocarcinoma. What about the hot? And actually the study showed that moderate association with the squamous cell carcinoma, but no study showed the association between is about 5 to 9-fold risk for the squamous cell carcinoma, but we don't have much data about the relation between the girl for the adenocarcinoma rather than the squamous cell. So the higher BMI frequently linked to the lower squamous cell carcinoma, and the higher. And the recent meta-analysis of 25 studies showed that in comparison, having normal BMI being underweight was associated with underlying esophageal cancer, esophageal disease, for example, patient with the achalasia or cystic stricture. The study showed the achalasia showed a population-based study including cancerous lesion for the adenocarcinoma, but no clear data for the pattern of the adenocarcinoma. The viral infection, of human papilloma virus in the esophagus, and also for the other viral infection. The H. pylori actually keratosis of the palm of the hands and the soles of the feet, and it showed the increased risk of the squamous cell, mainly with the inherited type, strongly linked to the squamous cell carcinoma, and you should begin endoscopic surveillance at age of 30 years for those patients. Now we'll talk about the difference in the clinical appearance and natural history of develop in multi-steps that begin with normal squamous epithelium, then progress to the low-grade intraepithelial neoplasia, then high-grade intraepithelial neoplasia, the specificity around 41%, the positive predictive value around 90%, negative predictive value around 72%, the accuracy around 88%. More advanced lesion characterization mucosa in the early stage extend along the wall of the esophagus, usually in the cephalic direction, and it may erode to the aorta and associate for the malignant cell. The adenocarcinoma subtype, the majority of this one located at EG junction and associated with the evidence of example, smoking, alcohol, and the other. And the upper GI endoscopy, the recent advance in the endoscopy, imaging, resection, ablation technique, and the chemoprevention. The recent study, the ASPECT trial, they used the aspirin and high-dose BBI in bariatric of squamous cell is declining, and the incidence of the adenocarcinoma is increasing in many countries. And squamous cell has multiple major risk factors, while the adenocarcinoma has a GERD and high BMI. Primary prevention remains the preferred strategy for reducing the global burden of the esophageal cancer. And recent advance in endoscopy for early detection, secondary chemoprevention has promising results.